Welcome back into Everyday Kentucky. We're here at UK HealthCare Sports Medicine. Dr. Ben Wilson is joining us today. And Doc, several things we want to talk about. I want to get on my soapbox for just a little bit. I think all medical care, especially here, is great. We want people to have a family doctor. They're the first line of defense. But when you're talking about pediatric injuries, it's important that they see a specialist.
Yeah, absolutely. I think one of the things that we see here is that our injury rates in kids, especially playing sports, has been growing increasingly, and not just because more kids are playing sports. That's great. We want kids to be healthy and active, but we see that rates of injuries in sports, like ACL injuries, patellar dislocations, Tommy John surgeries, are all increasing, even in relation to other pediatric injuries. When it comes to kids, we've got a saying in medicine that kids aren't just little adults, and especially our pediatric athletes aren't just little versions of our adult athletes. There's definitely some significant differences between kids and adults when it comes to both physiology and psychology and returning from injury.
You're much younger than I did, but to give you an example, we had a guy who was a great quarterback for our high school team named Gary Moore. But he broke his arm when he was little. And so we would always watch the film on Saturday morning, and this is how he would do touchdown. He couldn't straighten out his right arm. And those kind of things, you're not only healing injuries, but you're taking into consideration that growth, and so it's normal as well.
Absolutely. One of the biggest things that makes our pediatric athletes different from our adult athletes is that ability to grow. So a lot of times it can help us. A lot of fractures we can treat conservatively, casting, splinting, as opposed to us adults that would require a surgery. On the other hand, it can hurt us. Take ACLs, for example. Yeah. The way we reconstruct an ACL in an adult is we drill tunnels through the bone, we put in metal screws, and if we did that in kids, we could injure the growth plate. We could interfere with that growth that sometimes helps us. So in pediatric sports medicine, we have techniques. We can individualize the care to the kid depending on how much growth they have left remaining to limit that injury to the growth plates.
And kids are just going in so many different directions now, but it's also important, obviously, working out injury prevention, those kind of things before they ever have to get to you.
Absolutely. I tell my patients all the time the best surgery is the one we never had to do.
That's right.
The big things for injury prevention, we think about what exercises could they be doing. I talk a lot about maintaining flexibility and strength in kids. Often they have difficulties in balance and neuromuscular control, and we see that if we can train that, we can actually prevent ACL injury in up to 30% of kids. The studies are pretty good. The other thing that we think about is just the sheer volume of sports that kids are doing these days. Again, a lot different than when I was playing back in the day. Kids are playing year-round. They're playing on one sport, excluding the other sports.
Yes.
Higher levels, more pressure to play at a higher demand, and that leads to breaking down of the bodies that just aren't used to or aren't built to sustain that kind of effort.
And Ben, this is the kind of stuff you do every day here. People can see you on the sidelines or on the bench at Moorhead as well.
Absolutely, absolutely. So I'm here at University of Kentucky Orthopedics and Sports Medicine, also at Shriners Hospital here in Lexington. Take care of the athletes at Moorhead State University. I think what a great asset that we have here is our pediatric sports medicine division. We work closely with here at UK and at Shriners to give that individualized care to the younger athletes as well as our older athletes.
Ben, thanks so much, and thanks for what you're doing for our kids.
Thanks for having me. Great meeting.
All right, we'll see you next time on Everyday Kentucky.